put us at risk. When it comes to needles, cookers, cottons, again, I wouldn't suggest that you use any of this stuff, but if you did, use your own. And don't rely on these jailhouse remedies to clean the equipment, because we know that these jailhouse remedies are not guaranteed to kill these viruses. So it's something to remember. Tutors, razors, and toothbrushes, again, use your own stuff. That'll protect you from these body fluids of other people, and these body fluids could have this virus in it and put you at risk for getting hepatitis B. So when it comes to testing, again, testing is the only true way to find out if you have this virus. You can't tell just by looking at somebody. Just because they might have some of the symptoms doesn't necessarily mean that they have it. So getting tested is the only surefire way to find out if somebody has hepatitis B or if you have it. So you guys got any questions about Hep B? All right, let's move on to Hep C.
Is that the most dangerous one? When there's 7 of them?
Well, that's a good question. I would say that they're all pretty dangerous. All of them can make you really sick. But I think when it comes to severity, I would say that hepatitis C, which we're getting ready to talk about, is a real problematic virus. They're all problematic, but hepatitis C especially is problematic.
Is that the one that turns dark?
No, that's actually tuberculosis. When they give you a test,
Oh, yeah.
and where you get the little bump on your arm, that's for tuberculosis. Okay. And that's a test. And you're going to get one of those here. If you haven't had one already, you'll get one.
Just got one.
Oh, you just got one? Okay. Yeah. So let's go on to hepatitis C. Hepatitis C is a virus that causes inflammation of the liver. Like hepatitis B, it can be acute and chronic.
What's acute mean?
Acute means short term.
Okay.
So within 2 weeks to 6 months, about 15% of the people, or adults, 15% of adults that get hepatitis C, they develop an acute illness and they're able to pass it like a common cold or the flu within 2 weeks to 6 months. So 15% of the people, they get over it within 2 weeks to 6 months. But a much larger percentage, around 85%, they stay sick longer than 6 months, potentially for the rest of their lives, because they develop a chronic illness, around 85%. Go ahead.
If you get over it once, does that mean you build immune to it, or can you get it after if you were to pass it, could you catch it again?
That's a great question. Yes, you can. There are, this 15%, say they were to get hepatitis C once, and they were to pass it, they were one of these 15%, yes, they could get reinfected with hepatitis C. And the reason why is because there's multiple strains of hepatitis C. So let's say you get one strain and you're one of the lucky people that passes it. If you continue to engage in the risky behavior that how you got it in the first place, say you're shooting dope and you continue to shoot dope even after you pass it, you put yourself at risk for catching it again. And if you catch it again, a different strain of it, you could become chronic. And so it's something to remember. Some people pass it and they get over it, but then you can catch it again also. So, with hepatitis C, 15% develop an acute illness, get over it within 2 weeks to 6 months, but around 85%, a much larger percentage, go on to become chronic. And like we talked about before, chronic illnesses are serious because they stay with you potentially for the rest of your life, and they can do serious damage to your body, like we showed you before with this liver. Hepatitis C can cause fibrosis of the liver, cirrhosis of the liver, liver cancer, and it can be fatal. It can be fatal. Another something that I want you guys to remember is this. They did a study in the California prison system in 1999, and what they found was around 40% of the men entering the California prison system are infected with hepatitis C. That's almost half. And so it's something to remember. 3 things got to happen in order for you to get hepatitis C. The first thing is, you got to be exposed to somebody who has it. The second thing is there has to be an effective method of transmission. And the third thing is, there has to be enough of the hepatitis C virus in the body fluids. And in this case, the body fluid is blood. Hepatitis C is found in blood and is passed from person to person through blood-to-blood contact. So what does that mean? Well, we just went over some of it with hepatitis B. We're going to go over it again, though. Hepatitis B gets from person to person through sharing, what do you think?
Sharing needles.
Sharing needles, okay. That's good. Sharing needles.
Sex.
Unprotected sex, it could happen through that too. There's blood present there, it could happen. Unprotected sex. What else?
Fighting.
Fighting, that's good. Fighting,
Razors.
razors,
Anal sex.
could happen through unprotected sex, yeah, could happen. It could happen, that's good. Fighting, what else? Somebody said what, razors?
Razors.
Razors.
Toothbrushes.
Toothbrushes,
Yeah. Hair clippers.
ooh, hair clippers. Yep, toothbrushes, clippers,
Mm-hmm.
tat equipment,
Mm-hmm.
the ink, the needle, the barrel, right?
Yeah.
So before we talked about, when we talked about hepatitis B, I went this scenario with syringes so you guys understand that. It could be hepatitis C is passed through blood-to-blood contact, so it could also be passed through sharing outfits. Remember, if I had hepatitis C and I used this outfit and I took it out of my arm, there's going to be blood on the end of this, and if you used it after me, it puts you at risk for getting hepatitis C. We talked a little bit about razors with hepatitis B, but I want to go over this a little closer. Now, when we shave our face, after we get done shaving, we put aftershave on our face, what do we feel?
Burn.
Burn. What does that burn represent?
It's, the skin. It's, skin's came off.
Your skin is broken.
Yeah.
Exactly. When we shave, we create microscopic cuts on our face. Sometimes we actually see the blood. Take a little bit of toilet paper, put it on there, stop the bleeding. Sometimes we create cuts where we don't see the blood, but the cuts are still there. And we know they're there because when we put the aftershave on our face, we feel the burn. So I want you guys to remember that because sharing razors puts us at risk for contracting hepatitis C. And here's how. Now, just imagine me and you are cellies, bruh, and I got hepatitis C. And I'm on the yard, but you're in the cell. You're trying to, they call you for a visit, and you're trying to get cleaned up for baby girl. And you don't have a razor, but you look on my shelf, and I do. Now, my razor could have the cap on it, and you take the cap off, and there's no blood on it, there's no hair on it, it looks clean. You even rinse it under the sink. And you get to shaving. Create all kind of microscopic cuts on your face. Now, had I used this razor before you, and left some of my a microscopic amount of my hepatitis C infected blood on this razor, and you create those cuts on your face, those cuts serve as an entry point for the virus to go from this razor into your body and potentially doing this kind of stuff to your liver over time. So sharing razors puts us at risk for contracting hepatitis C. Sharing toothbrushes. How many guys have ever brushed your teeth before and spit in the toilet and seen blood? It happens. It happens. Brushing our teeth generates cuts inside our mouths. And so if you were to share a toothbrush with somebody else, that can put you at risk for contracting hepatitis C. Tutors, anything that's been exposed to hepatitis C infected blood could potentially put you at risk for contracting hepatitis C. But you got to remember, there's got to be an opening for the virus to get in. So, also, one other thing that I want to talk to you guys about was, I like to call it pill pocketing. You guys know what I'm talking about? Pill pocketing? You be in a pill line, and you see somebody, they'll get their pill, they'll tuck it down in between their cheek and gum, get a line and spit it out, and then end up selling it to somebody else or giving it to somebody else. Well, that pill could have hepatitis C infected blood on it. And hepatitis C can live outside the body. Could have the hepatitis C infected blood on it. And if you were to chop up that pill and snort it, that puts you at risk for contracting hepatitis C. If you were to crush that pill up and fix it, that puts you at risk for contracting hepatitis C. So watch out for those pills on the line.
I got a question. Why is
Yes,
why is it that with some individuals, like if you take the interferon shots for like hep C, why does it make you sick?
That's a good question. There's side effects.
Side effects.
Yeah, that's one of the side effects. It makes you, you know, your body has these reactions to it. And so there's side effects involved with interferon and the treatment. And I'm going to get to that in a minute. That's a great question though, because I've heard some people say that the side effects that they felt from it are really severe.
Yeah.
Really severe. It makes them feel bad. But I also know that some people that have gone on the treatment have actually, you know, it worked for them and it helped them get better. So there is treatment available, and like I said, I'm going to get back to that in a minute. That's a great question, brother. So, we know that these are some of the behaviors that expose us to blood. And blood could have this hepatitis C virus in it. So, these behaviors put us at risk for contracting the hepatitis C virus. So, I want you guys to remember that. Those are some of the methods of transmission. With symptoms, again, there are symptoms associated with hepatitis C, but the bottom line is this: you don't know you have hepatitis C until you get tested. So it's important to get tested. If you feel sick, or if you know that you've engaged in any of these behaviors with somebody that might have had hepatitis C, get tested and find out. Because that's the only real way that you can find out you got it. Go ahead, brother.
Does the spray you use on the clippers, does that kill hepatitis C, the real, the spray I'm talking about?
That's a good question.
Barbasol?
Yeah, Barbasol and the spray that you're talking about, these things are designed to kill virus and kill different kind of blood-related illnesses or viruses that are found in blood. But you got to read the directions on the can and on the bottle of Barbicide to find out for sure if the stuff actually does kill it. And it has to be used properly. There's directions on the bottle, and on the can. So, some of the guys might not be using the Barbicide or the spray properly, but you have to, again, you got to read the bottle or read the can to find out exactly how to use it. So I don't have a can here, so I couldn't tell you if it actually does kill it or not. But I would advise you when you get to the building or wherever you're going to look at it, the stuff that they're using, and look at it. And clippers is something, I want to go over this real quick because I'm not here to scare you with this information. I don't want you to be afraid to get a haircut. But there are certain precautions that barbers should use in order to protect their clients. When you're on the street, barbers have to go to what? Barber school. And at barber school, they teach them how to clean their equipment properly. And here, a lot of these guys haven't gone to barber school and they don't know how to clean it properly. So, just imagine this. If I had hepatitis C and a barber was giving me a bald head and he was going over my head with those clippers back and forth, getting it down as low as he can, and he went over a bump on my head with the clippers and cut my head and got some of my hepatitis C infected blood on those clippers, and then you sat down in the chair after me and he didn't properly clean those blades, and you sit down and get a bald head after me, and he grinds over your head, scraping all the hair off, getting all the way down the scalp, and creates a cut on your head, that could put you at risk for contracting hepatitis C. But again, remember, we talked about the second E, which of the 3 E's, which is effective methods of transmission. Actually sharing a needle with somebody that had hepatitis C, that's a much more effective way of transmitting the virus than actually sharing clippers with somebody that had hepatitis C. But there is still a risk involved, and that's a good question. You got to look at those cans and bottles of those disinfectants that they use to clean the equipment, and that'll tell you for sure. And it has to be also used properly. So, any more questions about that? All right. So, with treatment, there is no treatment for acute hepatitis C, but there is treatment, and we spoke about it a minute ago. Interferon is one of the treatments available for chronic hepatitis C. But again, you got to see your doctor and find out if treatment is right for you. So if you were to get tested and find out that you were chronically infected with hepatitis C or chronic hepatitis B, don't panic, because there's treatment available for both of them. And there's people who are living healthy lives right now who are chronically infected with hepatitis B and with chronic hepatitis C.
But there isn't a cure for hep C, is it?
No,
There's no cure.
There's no cure. And I'm glad you said that, brother, because a lot of times people get that stuff mixed up. What the treatment does will actually help reduce your viral load to, if it works, in the best case scenario, it would work to a point where the viral load is undetectable, where the virus is undetected in your body. But that doesn't mean that you can't pass it to somebody else still. You're still infected with hepatitis C, they just can't find it in your blood. Your viral load, the treatment has worked so well that it's actually undetectable. But that doesn't happen with everybody. For some people it works like that, for some people it doesn't for whatever reason. But treatment is a tricky thing, and I'm not a doctor, so I don't want to act like one, but I do want you guys to know that treatment is available. People are living healthy lives with chronic hep C that have been on treatment, and see your doctor to find out if treatment is right for you. So, that's the deal with treatment and chronic hepatitis C. When it comes to vaccines,